You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a fixed set of teeth, a permanent set of teeth in just a few appointments. With us, we have an expert on the topic, Dr. John Willardsen. Dr. Willardsen, welcome to the program.
Thanks for having me, Randy.
Now, we were talking before we started that I had you on my show about 11 or 12 years ago, talking about dental implants then, and you're still doing it.
Has it been that long?
It has. We used to jokingly say, but it wasn't a joke, I said, we used to call you the king of dental implants because that's all you did was dental implants.
Yeah, then I guess I still am the king because that's all I'm doing these days as well. So
good for you. Now, for people that don't know you, tell me a little bit about your practice. I know you're both in the LA area and Redlands. Who's the typical patient? What do you do all day, I should say?
Yeah, no, that's a great question. The typical patient really is anybody who's missing teeth, wearing partials or dentures, or uncomfortable with their smile. Anybody who is having these issues or self-conscious about their smile or having a difficult time eating.
You believe that though? No more dentures? The future of dentistry? Dentures as we know them today?
Absolutely, yeah. There's no reason really today that anybody should have to be stuck wearing a denture. The adhesives and how mobile they are, and it's just, today with guided surgery and with dental implants and the prosthetic reconstructions that we can provide, really nobody should be wearing dentures.
So from when I first had you on my show, what's changed? How much better is it now to get dental implants than it was?
Well, definitely the speed. We can get it done so much quicker today. The materials of the surfacing on the implants have changed. And so, the number one thing I would say is our comfort level. 10 years ago, we weren't reluctant, we weren't afraid, but we let things cook for a lot longer than we neaded to.
What does that mean?
Basically, when we put an implant in the bone, we didn't want to touch it for 3 to 6 months. And today, I'll be in on a case or on a surgery, and I will, as I'm placing the implants, I know right away if I can put the teeth on that day, which oftentimes we'll do.
So teeth in a day, you can do that right?
Absolutely, yeah, definitely. And comfortably, we'll place the implants and put the teeth on that day. Now, not all cases are candidates for that, but there are quite a few that are candidates to do it.
People travel to see you, right?
Yeah, definitely. They come from all over the place. I have patients from Florida, from New York, from San Francisco.
And I mentioned this show will reach over 20 million people.
Yeah.
And how many denture wearers would you say? Upper or lower denture?
That are candidates?
Like just in California.
Oh,
gosh.
Right.
How many
honestly, it's got to be
more than 100,000?
Couple 100,000, I'm sure, and in reality, it's not, if I could give a patient a set of implants, say we could test drive it, you can go to the car dealer and test drive a car. If I could have them test drive their fixed teeth for one day, everybody would do this. There wouldn't be a question as to, they would do it right away to get rid of the adhesives, to be able to chew and to masticate your food properly. Your digestion is improved. And not to mention, probably the main thing is just the psychological effect it has on you. My patients, it literally just transforms them. It gives them, I'll see them 6 months later and they're glowing. And, they don't really recognize it because they're used to it now, but it really is a major.
So people that used to come in, they'd never smile. Yeah. And now you see them come in and they're different.
Exactly. That's a great point. They were, obstructing their smile, or maybe they didn't smile enough. And now they don't hold back, and I think that's the main thing that I like to see in my patients is, they just don't hold back when they smile.
So if it's so good, then what's your take on why all of these people aren't getting dental implants? The denture wearers, why aren't they all doing this?
Well, I think for the most part, denture wearers have had a lot of dentistry, root canals, crowns, and basically they're in dentures because all of that failed. And so, and so they're not eager to pick the phone up and call a dentist and get in there and,
all right.
And I think probably a lot of denture wearers are researching dental implants, but there's no reason to wait. Really, there's no reason that.
It doesn't hurt, you say, because it seems painful.
With guided surgery and with the techniques we have today, the minimally invasive implant surgery, it really is not painful. It's not an issue that my patients have with
about?
Yeah, they don't really complain about pain.
How old are the patients that are doing this?
Gosh, I have patients in their 40s all the way to their 90s. But in reality, you think of somebody 40 years old in dentures, and I can't imagine, and then so they're too young to have dentures, but even the 80 or 90-year-old patient today, with the simplicity of the process, there's really no reason that anybody.
So a 90-year-old can do this.
Absolutely, yeah, definitely.
More risk of falling out if you're 90?
No, I mean, each case is dependent on bone density and that, but no, definitely not. I've done cases.
Why would a 90-year-old want to do it though?
Well, mainly because they want to be able to eat and chew and enjoy their foods. I mean, it's, and to have dentures and to go into a bridge or an implant bridge that's fixed, it's really life-changing. And so I'd say for every age patient, if they have those dentures or missing teeth, and it's the best thing they can do for themselves, Because you're like a cosmetic dentist when it comes to it. Because I've looked at your photos, and I said, these look really good. Yeah, I mean.
So there is the cosmetic part of this.
Right. I mean, people, they get implants, they want it to look good. I mean, it's critical that when it's finished that they're happy with their smile, that regain their self-confidence. Because, they've already lived, Randy, for so long with being frustrated with dentures or having gone to the dentist and had their root canals or crowns or whatever fail, and now they're stuck in dentures. So it's important that when I'm done with a case, that it works really well. They can chew, they can eat, they're not self-conscious about that, and also that it looks beautiful. And when they smile, they radiate. Okay, so let's take a look at the photos. Yeah, this is a great example of what we've been talking about. This patient came to my office who, with some of these issues that we've been talking about. She was self-conscious about her smile. She didn't like the fact that she was wearing dentures. And notice her age, Randy. She's very, very young. She's very young to have these issues at such a young age. And so, I did my diagnosis, my treatment planning. We came up with some options for her and a plan that she was comfortable with. And we went ahead and did it. And take a look at her after.
Very nice.
She is glowing. She's just... Well,
it looks very natural too.
It does, yeah. And so it's as if she's a different person.
And they don't come out. These are a fixed set of teeth?
Yeah, these are fixed. And so she, when I see her again in my practice, it's nice because I saw her in the beginning and I saw how kind of distraught she was a little bit. And now when I see her, I can tell that she really... It's changed her life quite a bit, and it's those are the things that motivate me. Take a look at this one, Randy, and she's a beautiful lady. And look at the before.
Yeah.
And notice, you might not off in the beginning see that there was anything wrong with her smile, but when she came to me and I did my treatment planning, she had a combination of natural teeth, bridges, crowns. Decayed teeth. So we had to remove a few teeth, place some implants, and rebuild her mouth. And so after having gone through the process with her, and take a look at her after, again, it completely transforms her face, her smile line. If we got into the details about her before and after, and we just notice how her teeth follow her lip line and follow her smile line.
Yes.
And she's relaxed when she smiles. And in her before photo, and I find this with a lot of my patients, it's almost like they're forcing their smile because they've been so self-conscious about smiling for so long.
Do they tell you they don't want to smile for you?
No, but I see it. I pick up on it.
Okay.
I pick up on it when I ask them. I'll take their before photos, and I can tell that they're reluctant to smiling and that they've been holding back. And so, but when we finish, they don't hold back anymore. They don't have to hold back. And so I think that alone psychologically makes such a big difference.
So those are dental implants. What I'm looking at the after, those are dental implants?
Again, they're a combination of crowns, dental implants, and but basically everything is fixed. Nothing comes out.
And when I first met you for the dentures, you did a lot of snap in, snap out. Today, what I'm picking up on, a lot of it is fixed, fixed, fixed. Nothing that comes out.
Yeah,
Has that changed with you?
It has, absolutely. I pretty much skew towards fixed because I know the benefit that the patient's going to have.
So you rarely do the snap in, snap out denture?
Yeah. It's, today with the minimally invasive implant surgery and, we can use less implants today. I haven't found really any reasons that I need to do something that's not fixed, and so in my practice today, I lean towards doing all fixed on all my patients because it makes such a huge difference for them.
Yeah, I mean, it seems like what everybody wants, right?
Yeah,
I mean, they
it
don't want
is.
teeth to come in and out.
Right. Yeah. No, not that there's anything wrong with doing the snap in, but it's so much better when you don't have to, take it in and out.
How many more implants do you use? So, but snap in, snap out is an option.
It
Still
is.
a lot better
Still
than
an
having
option.
a regular denture.
No question. Now, we can use from 4 to 6 implants to do fixed, and so
a full arch of teeth, 4 to 6 implants.
yeah, absolutely. And we have 14 teeth per arch, but we only need 4 or 6 implants to lock down a full set of teeth. So a lot of patients will think, well, I can't afford to replace all of my teeth, 28 teeth with all implants. We don't need to do that. We can use a fewer number of implants and still lock down a permanent set of teeth.
Okay, good. Now, more photos. Now, is it more women than men that are coming in? Or it's kind of a mix of both?
It's a mix. I think it's generally the wives will call for the husbands. They tend to not call to schedule the appointment, but by the time they come in and we meet them and their wife, and it's probably about 50-50.
Okay.
So here's another woman who she didn't like the bridge that had been recently placed, and
So the upper is a bridge.
the upper is a bridge. She's missing her 2 front teeth, and the doctor, the poor guy, had remade this bridge 4 times, trying to get something that she would accept. And finally, he just, and she'll tell me this, is he just cemented it in and said, "That's the best I can do." And so, and when I looked at her, I immediately.
How does she hear about you, by the way?
She either saw me on television or actually the dentist referred her to me.
Oh, good.
Which is
Okay,
that's
good.
that's exactly how she found me. He was frustrated and she was frustrated, so she came to my office, and when I looked at her immediately, I could see the end result. Which
Do you get excited sometimes?
Yeah.
And you say, "Oh boy, did you think I should have seen this lady a long time ago?" Sometimes.
No, I mean I had a little sympathy for the doctor because I understand. He
Okay.
tried. He'd done the best he could given the situation, but the problem was the whole mouth needed to be addressed and not just the front teeth, because in order to restore the aesthetic and the function and the bite, we had to fix every tooth and replace the missing teeth with implants and restore her mouth. And so if you'll take a look at the after again, notice she looks more relaxed. She's
Very
more
nice.
at ease. The smile looks beautiful, and she will say that she wished she would have done it a long time ago. And
I see couples. Couples are coming in and doing this?
yeah, yeah. This is a great story. This couple here who came to my office, and take a look at their before photos. They've again struggled with failed crowns and root canals and missing teeth, and they've had the whole gamut of dentistry done in their mouth. And I remember in speaking to them how they were leery because they had had so much done and they couldn't imagine doing it all over again, and how long is it going to take? And this couple here, I finished their mouths in about 3 months from start to finish. And so, but take a look at the after. Again, they look just alive and just
Like a power
happy.
couple now.
Yeah, and I mean, but this is a great example of what dental implants and dentistry can offer to.
So these people could have been in dentures, right?
Yeah,
Or
in
no?
fact, the wife was in a removable partial, and had bridges and crowns and missing teeth. So if they were to neglect or not do anything about it, eventually, yeah, they definitely could end up in dentures, which. And fortunately they came to me and we fixed it, and now they're good. Take a look at this couple. If you were to go for a job interview or you were hiring somebody,
Yeah.
which of these, between the before and the after, which one would you hire?
Well, obviously, if one's smiling and one isn't.
Yeah,
Were
but
they ashamed of their smile before?
yeah, again, they were very inhibited in their smile, and once it was done, they didn't have to hold back anymore. They could just smile and not even think about
I
it.
joked with you in the green room. You showed me this, and I said that they look like in this after, like they could be on a cruise line brochure.
Yeah.
I mean, they look like they're just happy, enjoying their life.
And that's how they are.
successful.
That's how their personalities are. But before I had done their work, they had to hold back, but now they don't have to. And so it really does make such a huge difference.
So they can eat whatever they want now, right?
Absolutely.
Did they ever give you eating and chewing stories?
I hear that from my patients all the time. You know,
Like, what do they say?
I can't eat this, or I'll go to go out to a restaurant and, you know, they can't order so many things on the menu. And so, but once they have teeth that are locked down and fixed into place, that kind of goes away and they can eat whatever they want to on the menu.
I mean, do they come in bragging every once in a while? You know, Dr. Willardsen, I ate my first steak, or I ate my first broccoli.
Yeah, you know, one thing I'll hear is biting into like hard bread or a steak. And you know, I haven't had a steak for 25 years or something. And it really is, that's the fun thing about what I do is hearing these stories about, you know, people that have been able to really have life-changing, you know.
So no more dentures. People
That's
tuning
right.
in, get a fixed set of teeth in just a few appointments. We're going to take a quick break. When we come back, more of the photos and more about the process, what people can expect on day one. You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. We'll be right back.
I've had so many compliments. People have noticed a vibrancy return to me. My confidence has come back and faith in myself has been restored. My health and my appearance have been renewed, and that makes me very happy.
Once I received my teeth from a doctor, I started losing weight. My appearance started looking nice, what I thought was looking nice, and I think I presented a complete package.
I feel like a kid again. I mean, I feel like when you've been reborn, you feel like everything is new. You feel like you have a fresh start again.
Of course, she loves to laugh, she loves to smile, we all do, but she's a little reserved with it because she was self-conscious about her teeth. She knew she had the teeth missing and she didn't want to smile too big to expose that. But now she has no qualms about that. She laughs and smiles more than I do, and we enjoy bringing her places with us because it gives people a trip. It's like, is that your sister? I'm like, no, that's my mom. It's like, oh, she must have had you boys young. I'm like, no, I won't tell you her age, but no, she had us at a good age.
Like I said, it's opened many doors for me, many doors. I'm dating more, you know, and I owe it to the doctor. I really owe it to the doctor.
You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. Get a fixed set of teeth in just a few appointments. With Dr. Willardsen here, he says that with just 4 or 6 implants, you could get a full arch of teeth and you can eat and you can chew. And you see this all the time.
Yeah,
I mean, you're doing this all the time.
Yes, I am. And it's, you know, we really can give somebody, nobody should be in dentures today. We can give them a full set of teeth that are fixed and permanent. And, you know, they don't have to live with the negative effects of dentures. You know, take a look at this guy who, again, he probably,
Oh my goodness.
he probably suffered, or, you know, he knew he had a problem and he suffered with that problem for, you know, 10, 15 years, who knows how long.
It's hard to even see those teeth, but that looks pretty unusual, though. That's got to be unusual.
Pretty much from every patient says that. Yeah, this is doc, I don't even want to open my mouth. This has got to be the worst case you've ever seen. And rarely is that the case, you know, which is one of the great beauties of what I do is, you know, I can take somebody who really feels like it couldn't be any worse as far as their
So
mouth.
this before, though, when I look at this, do you see this and say, wow, this is going to be good?
Definitely. When I see a patient like this and they come into my office and especially when they lead off with, oh, this has got to be the worst case you've ever seen, I know that, oh man, this is going to be good because I can fix this.
Okay,
And
you know where they're going.
absolutely. And, you know, this is a case where, you know, we did 6 implants and they're fixed and he doesn't have to take them out. And we got rid of the infection. We cleaned up the gum tissue and literally he's able to, it's as if it never happened. And for most of these patients to lose their teeth is such a
He doesn't even
big
look like the
deal.
same guy, by the way.
Doesn't he look
You could
great?
tell because of the beard, but or the goatee. I mean, but he looks almost handsome, kind of.
Yeah.
I mean,
yeah,
before you'd never say that's a real handsome guy, but in the after, he's a handsome guy.
exactly. And
How important is this smile? Because you're a
That's-
dentist, of course you think it's important.
well, there's studies that show that the smile is the number one thing that people look at when you make that first encounter or when you meet somebody. they look at your smile, and
All right.
and so it is very important. And to be self-conscious, it can change a person's personality if they're not smiling, or you might think they're grimacing all the time or not happy or whatever. And so, like we had talked about, if a person who comes to a job interview is not smiling, most of the time they may not get the job, and they may
point.
not be smiling because they're self-conscious about their teeth.
They're hiding something.
They're hiding, yeah.
So when I see miserable people walking around, they might not be miserable. They're just hiding.
Very possibly
To not
could
make
be.
Fun of them, but there's a lot of
right.
people self-conscious about their smile.
That's
you're saying.
right. Yeah, and there's really no reason today, with the current technology we have, with the techniques we have, that people should not or should be running around being self-conscious about their smile.
Do you think they wait too long, like this guy?
Definitely. Yeah.
I mean, they wait just too long.
Yeah, I mean, the sooner you can address it, the better, because then, we don't have issues with bone loss, and not to mention the fact of just having infection in your mouth and your body trying to fight that all the time.
Okay, good. Now you have more photos. We're gonna have to kind of go through those for the sake of time.
Yeah,
So what else? What else do you have?
So here's a guy who, he had suffered with dentures for 30 years, and he's an active guy. He runs on the beach every day, and he knew that he just didn't want to suffer with dentures for the rest of his life. And yeah, so take a look at the before and how his lips are sunken in, and we've got these the wrinkles are more defined. Whereas in the after, I did on this
Very
patient,
nice.
we did 10 implants on the upper and then 8 implants on the lower, and he has fixed on the upper and the lower. And it really just it gave him again a new lease on life.
So 30 years in dentures,
yeah,
and you're still a candidate.
right, exactly.
Do you ever hear this where a patient comes in and says, I think you told me this, where they say, I was told somewhere else I couldn't get this done?
Yeah, I definitely have had that situation where a patient has been told they don't have enough bone, or whatever the case may be, and I've grown 10 millimeters of bone in an upper jaw, in the past, in order to provide enough bone for the implants. Those are extreme cases, but so far we've not had any cases that we just could not do.
Are there people, for example, with your experience, I mean, and for people tuning in, we're talking about no more dentures with Dr. Willardsen. 10 years ago, we were calling you the king of dental implants, right? and you didn't like it back then, and I don't even think you like it today. But all you do is dental implants. I mean, you've been doing it from the onset, okay? Yeah. Are there people that you would have had to turn away 10 years ago that now are candidates today with what you know?
Probably, yeah. Yeah, today we definitely don't have to turn anybody away, and and with the technologies we have, and with the implants we have, everybody is a
So
candidate.
no more dentures. Okay, time for a couple more.
And I have hundreds of pictures and before and afters I could show you, but but just take a look at this, and I love these. I love doing this because it really just makes such a difference. And look at her before, and how she was self-conscious and she was not able to chew the foods that she needed. And we had to remove a few teeth, place a few implants, and then we redid her whole mouth, and it just transformed her smile.
Now she has a pretty smile.
Yeah, it is. And in this situation and every other situation, they are no longer held back by their smile, and they're able to eat the foods that they need to, or they want to eat.
They ever give you a hug
Yeah.
and say, Dr. Willardsen, you're the best?
All the time. No.
But you get that.
It
right?
is. It's great, because I'm able to make such a difference for my patients, and and I love what I do. I have to say, it really is. When I meet a person on our first visit, and I can visualize where I'm going with their mouth and their life, basically, it makes such a difference. And when we're finished, it all comes back, and I can just see it and I can feel it, and it's just great when it's all done.
What about consults? Do they have to pay to see a consult with you?
No, I mean, we do free consultation, and take the X-rays and the necessary imaging that we need, and then from there we decide what's going to be the most economical way to get them to where they need to go.
Okay, now final message. Somebody watching this, missing a few teeth, they've been told their teeth have to go, or they don't know what to do. They haven't been to the dentist in 15, 20 years, and especially to the denture wearers. What do you say to them?
I say come in for a consultation. Don't wait any longer. If you've been thinking about this for years and years and just haven't had the courage, again, like we had talked about initially, I haven't seen anything that you know, is so bad that we couldn't fix. And the greatest thing about it is that we can fix it, and when it's all done, a lot of these issues go away. And so I say, come in and let's sit down, and we'll come up with the best game
Are they ever
plan.
left without teeth? I mean, if a denture wearer comes in, are they left without teeth?
No, they never go without teeth. And you know, once we're finished, you know, they can go have a steak and go eat whatever they need to once we get those teeth locked down on the implants. And they're very solid and very strong. And you know, and it really just, once that happens, they feel liberated and free.
Okay, good. Final message. Somebody watching this, and maybe they're still afraid. They're a denture wearer, or they've been told their teeth have to go. What do you tell them?
Well, you know, there's no reason to be afraid. We do most of our cases under anesthesia, and so there's no pain involved, and it's not like you're awake during the procedure. And, you know, don't put it off any longer. I mean, it's just too important of a thing to have that we can fix, just to get it done and get it taken care of and not have to carry that around.
People think about it for a long time. Like, for example, with you, I had you on my show 10 years ago, 12 years ago. I think it's either 10 or 12.
Yeah.
Did they ever say, I've been watching you on TV for 10 years and I finally came in? Has that ever happened?
Yes, definitely. And I'm always shocked because they'll say, oh, I saw you on TV, you know, 2 years ago, 3 years ago, and finally they make it in. And, you know, my message is just get in and let's and at least get the process started so that, you know, we can and so that you don't have to live with this burden any longer.
It's less expensive if they go earlier, right?
Yeah, because then there's less bone building that might need to be done. Definitely you'll save in both time and money the sooner you get in to get it taken care of.
Okay, good. Always a pleasure to have you on the show. And they
Appreciate it,
could find you're all over YouTube. So if they put in John Willardsen, Dr. John Willardsen, you've got patient testimonial videos. They've got your website. You have a bunch of photos. And,
That's right.
And a free consultation.
That's right.
All right. Thanks for coming to the show.
Thank
You've been
you.
watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can visit our website at wellnesshour.com. Put in John Willardsen or Detnal Implants. You'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.